For coming. We have a very special guest this month or this week. Rosie Rowe has come from the western part of Australia, but a town called Hamilton, right? And she's the Director of Community Services and Allied Health at the Western District Health Service in Australia. She's also the Handbury Research Fellow. And her interests are in innovative approaches to addressing health outcomes of climate change for rural communities. So she'll be speaking about her work on climate change in Australia. Thank you.
Thanks, Martha. Well, it's really lovely to be in Halifax and to be talking to you about this topic. It's something that we started to talk about really about 2.5 years ago, starting to look at climate change from a health promotion perspective. What as health promotion, health prevention people should we be doing about climate change? So, what I'm going to just briefly talk about today is two things. First of all, a planning framework that we have developed to help us guide and plan our local adaptation work. And secondly, just a snippet about a local community research project that we've been working on. So being mindful, I work in a health service, so there's very lay research, yes? I have hooked up with a research mentor from Penny Hall from the University of Calgary, who's Australian, so she's guiding us in this work. So it's early days, but I'll go through that. So just to give you a perspective on where we are, you can see down there, right down there in Australia, and so we come right down to Australia, and we're right down the bottom of Australia. So some people in the audience have been there recently. We're right down in Victoria, and so we're in a rural area 3 hours west of Melbourne. So I printed off some stats about this rural area. We have 5.3% of our population born overseas. So you can see we're actually this particular part of Victoria is the most Anglo-Saxon part of Victoria. We only have 0.59% of Aboriginals. 61% have lived in this same LGA, this same local government area, since 1996. 6% unemployment. So you can see that it's quite an unusual area, quite conservative because of that background. There's Hamilton, west of Melbourne. So just to give you a bit of a sense of what we do, it's a farming pastoral area. We have got the highest merino flock in the world. And as you can see, it's beautiful grazing country. I've been warning Judy that we have mountains in our area. That is a mountain. It's actually a volcano. So we're an international geopark with very interesting geology and volcanoes right throughout. So you can imagine anyone here with a geological background will know that the soils are extremely rich and fertile. So it's relatively good rainfall, and it's been a very prosperous area. This property here is where I live. I'm very lucky to live in this property. It's 5,000 acres, and it's part of one of the very old pastoral families and pastoral leases. So you can see that the house was sort of early 1900s, and that it's a very strong. It also is a very strong conservative area, which makes our work on climate change very interesting. So that's a bit more about seeing the landscape. So as you can see, it's been cleared for farming. But increasingly, this community is realising the changes already. There's a lot of cropping that's further north. Our agricultural industries are cropping, but that's increasingly coming down into this grazing country. So people are seeing the changes. Farmers are shifting their industry, and they're clearly really the debate about climate change now in Australia is not whether it's happening or not, but whether it's man-induced or not. So the debate is what we should do about it, how much money we should spend on it, but clearly, is it happening? Yes, it is. Though in our particular area, again, because of it is a very conservative, socially conservative area, so some people would suggest to me that perhaps 40%, particularly of our farming community, would be still pretty sceptical. Yeah, so that's the landscape or the context of our work on climate change. So it's hot down there. It's probably 28 degrees. This is taken in midsummer, so this is kind of our farm dam swimming, muddy toes, that sort of thing. It's a lovely place to live. So the work that we have produced, as I said, began 2.5 years ago when I was running a primary care partnership, which is a partnership of local government, of health services, of education, a big broad partnership of agencies work together on particular community health issues. And one of the things they asked me 2.5 years ago is, what will we do on climate change? And I really didn't want to answer that question because no one had started thinking about what we would do. The initial response from our agencies was, well, we should all change our light globes and turn our hospitals into a kind of, you know, a green, sustainable environment. Actually, that's not what we were about. As a network of community health agencies and acute services, it was actually about our core businesses in health. What do we do about that? So I'm just going to this work is on our website and published, supported by the University of Melbourne. And I just want to give you a quick walkthrough about what it says. So there was already some work done, and I'm sure this is easy work for you to track, is the direct effects of climate change, the direct health impacts. So it's about disease vectors, because as things warm up, we will actually have some of our tropical diseases coming south. It's about different changes in our waterborne illness. As water levels get reduced, as our water tanks actually are more susceptible to waterborne illness. It's about other heat-related deaths. So there's been a big focus on increasing heat, particularly in urban areas, and additional deaths from that. So I presume many of you have followed the thousands of people that died, I think in summer '08 in Europe, mostly elderly in urban areas. Well, in Melbourne last summer, we had approximately 250 people who were above the normal level of our mortality die from a week of heat wave. So heat wave is what our public health agencies are particularly looking at. And extreme weather, so fire, and storms and floods, all of those things leading to public health issues. So they're the direct impacts, and the Department of Health released that report in '07, had some health forums about the direct impacts. But we knew that the story doesn't stop there. For those of us who are working in more population health and looking at the social determinants of health, we started to think about, well, what else is going to be impacting? And these are some of the indirect impacts that we were starting to think through. Energy, food, water and transport. The costs of those are increasing because of their scarcity. And we already know that energy prices in Australia will substantially increase. There's been some estimates that to air condition your house, because they're going to ramp the price up of air conditioning on hot days to actually control demand. They don't want people turning on air conditioners because of risk of power outage. So they'll ramp it up. Some people suggest by $75 a day if you want to air condition your house. Now, for many people, that is really a requirement in their life to keep themselves cool. So it's a key factor. If you're disadvantaged, clearly increases in price of these utilities is a major impact. The increased stress and uncertainty. So this is a scale of change and a scale of uncertainty, whether it's in your business, whether it's in your home life, that is of a degree clearly that you can't control. So that is certainly of concern for mental health agencies. And lastly, around reduced social connection, largely linked to if fuel prices are so hard. We see this in our drought conditions. We've had drought for 10 years, and there's been a lot of work done in population health around the impacts of drought, mental health, reduced social connection. You don't want to go into town because you actually don't want to tell people how bad things are on the farm. Yeah, when things aren't going well for you personally, it's not about jollying yourself down the street saying, "Hi, it's so lovely to see you. How are things going?" That's not the conversation actually you want to know about.